My name is Dr. Hunter Bane. I'm an obstetrician gynecologist, and I'm coming from Little Rock, Arkansas, and the University of Arkansas. That's where I did both my medical education, got my MD, and moved on to residency from there. I provide comprehensive women's health care. So on the obstetrical side, of course, that is high and low risk pregnancies, taking care of pregnant women from the time they start their pregnancy in the first trimester all the way through to delivering their baby and any complications that arise therefore. Then on the gynecology side, I provide all sorts of care. So whether that's well woman visits all the way to large surgeries that they may or may not need, and in-office smaller procedures as well. I have a specific interest in minimally invasive surgery, specifically robotic surgery. I became really attracted to the specialty of OBGYN. Mainly because it's a happy portion. There's a lot of things in the hospital that are doom and gloom, and this is really can be a portion of a woman's life that is the happiest thing, handing them their baby. So that's the first thing that attracted to me. And then more so on the gynecology side, it's can be really life-changing for a woman to have a outpatient procedure. And so I really like to offer that to them as well. Something that used to be a couple of days to a week in the hospital, to now be able to give that to them, in a day's time is really important. I think a lot of OBGYNs, when we're kind of going through medical school and when you're going through all your different rotations and trying to figure out what you want to do with your life, you fall in love with labor and delivery. It can be a portion where you can really make a difference in someone's life, something that can be, very scary or even traumatizing to some, to really calm and to have a happy outcome. It's really special to be able to hand someone their baby. So that's really what attracted me to the specialty to begin with. So I was actually born and raised in Springfield. And I went to Missouri State for undergrad, so I was really bred and born here. And I went away to Arkansas for my training, and coming back home is something that was really important to me and is special. And Cox Health, I worked here as a tech for a year before going to medical school, and actually I started off in patient transport for a couple of years before that, kind of going through undergrad doing that. So it's kind of surreal to be coming back to the system in a different capacity. So if I'm not in the hospital, I am getting outdoors. I love to fish, I love to hunt. I have a little black lab, his name's Hank. I love spending time with him. So if I'm not in the hospital, I'm outside doing something. Beyond that, definitely spending time with friends and family.